Dr. VanDyke here, taking a walk in the Galapagos Islands, but wanting to talk to you about menopause management. The first thing I want to say is women deserve better. They deserve better than the lack of data that we have about innovative therapies. They deserve better than to be led on a wild goose chase, mostly focusing on supplements and pellet therapy. What I can tell you is that hormone therapy is not the nightmare that we used to think it was. There was some data published back in the earlier 2000s that kind of scared everybody. We have an entire generation of physicians that are not familiar enough with how to prescribe hormone replacement. And it scared a lot of women away, and their quality of life and their medical outcomes have suffered. Menopause is kind of like a metabolic bomb going off in the body. And we know from lots of accumulated data that when we intervene responsibly with the standards of care, estradiol and progesterone when needed, that we have tremendous cardiovascular and bone metabolism benefits. Not to mention controlling these symptoms we call vasomotor symptoms that enhance quality of life, quality of sleep, etc. So when you're trying to figure out what should you do about your menopause symptoms, if anything, don't get caught up in the endless array of schemes online that promise stunning results, usually trying to sell a supplement or convince you to have something implanted. Hormone replacement therapy should be safe, it should be cost-effective, it should be covered by your insurance. And it should not produce hair growth in places that you don't want it, or hair loss in places where you want to keep it.